Here. So with that, we'll let him introduce himself and who he's with.
Hi, I'm Dr. Jon Van Der Veer. John's a lot easier to remember though. I am the founder and CEO of Hy-Vee Health Exemplar Care here in West Des Moines and in an expanding footprint.
Well, that's amazing. So John, we've been following you for a while, mostly on LinkedIn. And
Jacob from LinkedIn, it makes sense.
Yeah, it's expanded a lot. So kind of what is Exemplar Care for people that don't know, because you are expanding. What's Exemplar Care? How did it come to be? Give us a little bit of the backstory.
So Hy-Vee Health Exemplar Care is a direct primary care clinic. So about 5 years ago, started off on a venture to kind of leave the bigger medical industrial complex that healthcare has become. Basically, it's a membership or concierge light version of healthcare. So you get all of your primary care, your acute care visits, labs, blood work, all of that stuff is included into a single monthly rate. So you really don't have any surprises on what your cost is going to be. And I said the concierge light part because it's really just the fee that's light. The services are really robust.
You're right. Sometimes in the healthcare, you do get surprised.
Yeah, so we've even built it in so that you kind of know we can get your estimates of services if we don't have them available to us, what they're going to cost if you end up having to go somewhere else for specialty care, beyond the primary care and urgent care that we provide.
Yeah, transparency, really important.
Yes, and lacking in just about everything you see in healthcare today, so we really pride ourselves on here's the cost, here's the price, and everyone can make their own decisions from that point.
Well, perfect. So, John, it's Y Wednesday, and so 5 years. So 5 years ago was, 2019, 2020.
Pre-pandemic.
Like,
yeah.
Wild time. So you go off on your own and start building what is now this, and all the locations you have. Going on the entrepreneur route, and it's way easier to just work corporate.
It is.
Way
it's
easier.
Much simpler.
So walk us through, what's that why? What's the thing that gets you up? I joke sometimes we're in Iowa, so sometimes it's 20 degrees outside but feels like negative 40.
Like today.
Yeah, like today. And so the alarm goes off. What's driving you getting you out of bed when you really just want to stay in the comfort?
So going back to my corporate medicine days, I really hit what is actually defined as clinical burnout. I mean, you just see so many people, and I hated having a computer between me and you as you were the patient. So I did all that stuff at night. I did all the work there, and it just really kind of weighed on enjoying it. You realize, I don't really like my job. I don't like seeing patients anymore. And I had some people say, clinical burnout, that just means you don't like your job like the rest of Americans. Except for when physicians don't like their jobs, there's increased morbidity and mortality, so bad outcomes and death. So for patients, it really matters. So I wanted to figure out how do I get to a place where I'm back to taking care of people. Because as you say in your medical school interview, I want to take care of people. It's actually true. So how do you do that, and how do you get to have that time with people? And as I went through this, the direct primary care model really is the way that gives back the most time to build a patient-physician relationship. And so visits can be 30, 60 minutes, where it used to be 10, 15 minute visits, in and out, get your blood work, go get your referral, get a medication, and off you go. So now you get to sit and spend time talking about people's diet, their exercise activity, the things I'm trying to do to fix those for myself, and actually build a relationship that is positive for both of us. And it allows you to feel more comfortable as a patient saying, I really have these concerns and I haven't had time to ask before, and now you get that chance.
Well, we love that. It's really important, especially when you're making decisions about your future health. You have somebody that you trust and not somebody you see for 18 seconds and doesn't listen.
So a model that really cares about that interaction is why I got into it and get out of bed. I mean, and I still spring out of bed every morning to do this. It's fantastic.
Well, we love that. So people watching, we call it target market in like the business world. So who are the people that Exemplar Care should be on their list of, hey, we might be a good fit for you or a good partner for you, whether a business or an individual? Kind of walk through some of these people that like, oh, maybe we'll do it this way.
Some of the, we kind of split things off into kind of the employer group space, because we do a lot for employer groups to increase access, price control, and transparency, so people know what cares will cost. And it gets employees engaged in their care. They go see the teams more often, they get care they need more often. And then there's the individuals. So the individuals, we joke, and every study shows like a 34-year-old female who is a mother of 2, etc., involved in lots of activities and wants convenience, speed, access, and membership allows you to get seen same day, next day, basically all the time. You don't have to wait 3 to 4 weeks to get in. So on the individual side, those people who, they're busy, they've got life to live, they want to know that they're going to get care when they need it. So that's one bucket. And then 2 is the forward-thinking, entrepreneurial, advanced leader who really wants to provide a true benefit. I mean, insurance is a benefit, wellness programs are a benefit, but something that doesn't cost an employee any more money. They go and they get it and they get taken care of, and it's a true benefit to them and their family.
Well, we love that. So there's probably some of you watching that you fit one of those categories. Dr. Jon's awesome. The last thing we always ask though, every guest, the people that made it to the end of the video, we want to add value. So what's one piece of advice, personally and professionally, if they start applying today, they'll be better for it tomorrow?
So it is really for both your personal and your professional life. And that is surround yourself with really good people, people you like, people who are smarter than you, who are going to push you, who really want to help you live out your dreams, whether that's in your personal life or your professional life. Like, you need a team, you need an army to go forward and really make good progress. So that's my best piece of advice.
Well, I love that. You will be better for it. Thanks, Dr.
Thank
Jon.
you, sir. And to everyone, we look forward to seeing you at Jacob's Iowa Wolves basketball game.
Yeah, bobblehead will be today when this is being shown. So thanks for watching,
Pretty
guys.
awesome. Thank you.
And we'll see you next time.